Welcome to the Care for Caregivers and the Refugees of America Assistance Program, also known as RAP, conversation with a gem of Henry County, Miss Amanda Reeves, Hands of Hope Clinic. One of the initiatives of Alpha Kappa Alpha Sorority Incorporated is to raise awareness of critical healthcare issues impacting African American women, such as breast cancer awareness and prevention, heart health, nutrition and wellness, and of course, care for caregivers. Now, Ms. Latasha Robinson will introduce Ms. Amanda Reeves.
Greetings. It brings me great pleasure to welcome Amanda Reeves, who serves as Executive Director of Hands of Hope Clinic, Henry County's only charitable medical, dental, and mental health counseling clinic. In her role, she is responsible for oversight of all practitioners and staff, funding, budgeting, program development, recruiting new providers, and public relations. Amanda holds a bachelor's degree in human services from Mercer University and a master's degree in organizational development from University of Georgia. Prior to the time she joined Hands of Hope Clinic, she spent 26 years working in the financial industry as a market manager for BB&T and 6 years as a stay-at-home mom. Amanda is also the founder of Millie's Mini Pantry in McDonough, a charitable community food pantry for those in need. In her free time, Amanda enjoys reading, spending time outdoors, and being involved in community events. Born in Gwinnett County, she now resides in Henry County with her husband, Jason, and 2 daughters, Jordan and Aslan. Her personal motto is, God always wins, and she works to put Christ at the forefront of every decision and interaction in life, recognizing that even when things don't go as she planned, God has a plan, and He always wins. We welcome Amanda Reeves.
Thank you so much. That was such a wonderful introduction, and I'm just so thankful for everything that you ladies do for our clinic. It's such a blessing to me to be able to talk with you all about Hands of Hope Clinic. Hands of Hope Clinic is the only charitable medical, dental, and mental health counseling clinic in Henry County. We are a registered 501c3 organization. We are funded completely by grants and donations, and we are so grateful to have the opportunity to spread the awareness of what our clinic does. Our motto is to bring hope and better health to those we serve. That's our overall mission, recognizing that there are many all throughout the United States, but especially right here in Henry County, who do not have access to the basic health care that they need. If I could tell you a little bit about how we began, if I could have the next slide for this presentation, I'll share with you about our founder, Janet Turner. Here she is, the lovely Janet Turner. Janet is such a wonderful lady. Janet single-handedly determined that there was a tremendous need in Henry County when she was making delivery of day-old bread that she would pick up from local grocery stores, and then eventually it became pizza that was left over from Pizza Hut. If somebody called in and made an order and didn't come and pick it up, Pizza Hut would let Janet have those pizzas, and she would drive out into communities within our county that were in need and deliver that food. And as she was delivering that food to the people who needed it, she recognized that there was a great need for medical care for many of these individuals, and they just didn't have the ability to receive. They had no money to do it. They had no transportation to get to where they needed to receive the care, and they certainly did not have the awareness of how to receive the care that they needed without the resources to pay for it. So she sought out local physicians and asked some people at her church, McDonough Presbyterian Church, if she could use the fellowship hall for a once monthly clinic and open the doors to the people in our community who were in need. And people just decided to help her. She had such a heart. And they began having a clinic at McDonough Presbyterian Church, and within weeks, the line for help was around the building, out the door and around the building. So over time, 5 years, as you see on this slide, she worked really hard to get an actual clinic established and open, sought people at what was then Henry Medical Center and is now Piedmont Henry Hospital. And Piedmont Henry Hospital partnered with Janet and the physicians that were willing to help those in need and allowed them to establish Hands of Hope Clinic on the campus of Piedmont Henry Hospital. And we are still there today, 17 years later, in Building B, right on the campus of Piedmont Henry. Janet's philosophy is that every person has a right to quality health care. I don't think anyone could argue that if someone is sick or in need because they're injured or has diabetes, a chronic illness, I don't think that any person with any kind of heart would argue that a person didn't deserve to be helped. So that was absolutely what Janet's philosophy was, and she single-handedly started this entire mission. Next slide, please. So Hands of Hope Clinic was founded as a faith-based Christian nonprofit clinic offering hope to the underserved and uninsured residents of Henry County through quality medical, dental, and mental health care, resulting in individual and community health and well-being. It's important to understand that when we are serving the people in Henry County who are living in poverty and have a need for this care, we are helping the entire community, not just that person that has the need. You and I may have health insurance through our employer or through the private insurance market. There's so many people in our own county who don't yet meet the qualifications for Medicaid. They're not old enough to receive Medicare. They don't have VA benefits, and they can't afford to purchase private insurance. So people in that position come to us, and we're able to give them the care that they need. And if you think about how the community is being helped overall, something that a lot of people do not understand about charitable clinics is that we have a really grand ability to help our local hospital systems. I don't know if anyone on this call or watching this recording has ever had to go to the ER at any hospital, not just Piedmont Henry, but I think we all know if we have to go to the emergency room, we're going to be sitting there for a while unless we have an absolute life-threatening injury or illness. So something that we do to help our local hospital system is we take the patients out of the hospital system and out of the ER, the patients that aren't paying. Obviously, they don't have insurance, and even though our local hospital system is a nonprofit hospital system, they still have a need to generate revenue because Henry County is the third fastest growing county in the state of Georgia. So as our community grows, our hospital needs to have the ability to serve more and more residents of the county. We have over 300,000 residents in Henry County, and our hospital has 330 beds. So if we can take patients who aren't paying out of the hospital system and get them the care that they need, educate them about how to manage their chronic diseases that are the reason they're going to the hospital in a lot of cases to begin with, we can keep them out of the ER, out of those 330 beds, so that those people who have insurance and do have life-threatening emergencies are the ones that are going to be seen most frequently at our local hospital, and therefore the hospital can generate the revenue that they need to purchase the most up-to-date equipment, to hire additional practitioners to treat the patients, and to add space in their facility so that there's more beds than 330 for a community of over 300,000 people. Next slide, please. So I just touched on this briefly about patient eligibility criteria. And so obviously any of our patients that are coming in and receiving care are uninsured. Again, they don't qualify for Medicaid. They don't have VA benefits. They don't have Medicare. They have to be a Henry County resident. They have to have income less than 300% of the federal poverty level. And they go through an eligibility screening process. They provide us documentation to prove their residency and their financial eligibility. It's a simple process. We can get them seen within 24 hours, sometimes a lot quicker if they can get us all the information that we need. We can accept utility bills, a driver's license, anything like that to establish their residency. And then as far as their income goes, we just can have a copy of their tax return or a statement, a wage and earnings statement from the Department of Labor to show that their income met those guidelines, and we'll get them seen right away. Next slide, there we go. So since 2004, when we were founded, we have served 9,763 unduplicated individuals through 56,421 visits. So let me just put this in perspective for you. We have 7 employees altogether. We have 5 people who work full-time in our clinic, and we have 2 people who work part-time in our clinic. And then we have just a really broad range of volunteer practitioners in primary care and then also in specialty care. And if you think about the fact that we've had 56,421 appointments, and we've had, our staff right now is the biggest it's ever been. We've never before had this many staff members. Typically, we've had just a few paid staff members and then a whole lot of volunteers, but we've grown so much and serving 56,421 appointments, we've had to, have a greater paid staff so that we can guarantee we have the people there to provide the care that's needed. We do provide primary care services, well woman care, such as mammograms, pap smears, specialty services. Just to give you a little bit of an idea of some of the specialty fields that we are able to offer care for with our patients, we have a podiatrist, we have cardiologists, urologists, gynecologists, obstetrics. We do not treat obstetric patients, but we can refer them to a physician that partners with us if they need care for pregnancy. So we also provide chronic disease management. Diabetes and hypertension are off the charts for people living in poverty. As you can imagine, if you are impoverished, you do not have the ability to purchase the healthy foods. Affordable food is usually food that's processed and just not good for us to eat for every meal of the day. It's one thing if we want to have a snack every now and then of something like that, but people living in poverty cannot afford to buy the healthiest options, and so they develop diabetes and high blood pressure. High blood pressure also comes from stress, as you can imagine. If you are a parent who has children that you can't support financially, you cannot afford to pay for housing for them or health care for them, your stress levels are going to be through the roof, and so hypertension may develop. We also provide mental health counseling, the health and wellness education classes. We teach our patients how to manage their chronic diseases through nutrition, exercise, stress management, mental health management techniques. We also help our patients obtain free or reduced cost prescriptions. We have great partnerships with pharmaceutical companies. We have to provide documentation to these pharmaceutical companies to demonstrate that our patients cannot afford to pay for their medications and that the medications are a necessity for the patient. So we're able to get those medicines for free or at a much reduced cost. That includes insulin. Anybody who's been a diabetic or knows someone who's a diabetic knows that that medication is incredibly expensive. It can equate to a mortgage payment each month for some people who have to take multiple medications several times a day, $1,200, $1,300 a month. I don't know about you ladies, but I personally could not afford to pay for medication like that if I didn't have insurance. So we help them get those medications for free. We also provide referrals for patients to volunteer specialists within our network. And then of course we have dental care. If you're living in poverty, you're probably not going to go to the dentist to get your teeth cleaned because that's pretty expensive, especially when you don't have insurance. So over time, you have decay. Your teeth are, rotting and they're painful and they're causing infection. They can cause heart disease. So many other illnesses can come from not managing your teeth. So dental care is a vital part of the service that we provide to our patients. We can do preventive cleanings. We do fillings. We do simple extractions, x-rays, including panoramic x-rays and bite wing x-rays. And let me just throw in here that all of those services are totally free to the patient. The patient does not pay one dime and they are not obligated to us in any way. We are just here to help them. We work very closely with Piedmont Henry Hospital, as I mentioned, to keep patients out of the ER. Naturally, if the patient has to go to the ER for an emergency, they're not going to be turned away, of course. But when they are discharged from the hospital, the Piedmont Henry staff is referring those patients directly to Hands of Hope Clinic as their primary care provider. We have appointment options of Monday through Thursday from 9 to 5. For medical visits, our dental clinics are held on Fridays. We have appointments for those as well. And patients typically must qualify and enroll for services prior to a first appointment. If there's an emergent need, if someone's a diabetic and we're able to see that they are very ill, we can help them before we qualify them with one visit in order to evaluate what their condition is. And then we will get their qualification paperwork and then have them complete enrollment after that first appointment. Funding, as I mentioned when we first opened, we are 100% funded by donations, grants, and fundraisers. So we depend upon the goodness of others to give to our organization to allow us to help those that are in need. As far as the grants go, we have about 14 different grants That process alone is very tedious. Grant reporting is a big job. Grant applications are a big job. And fundraisers take a lot of work and a lot of people to put together. So we have to do all of those things with our 7 people and then anyone else who is willing to help us as a volunteer. Next slide. Okay, let's talk about demographics. So this is always so interesting to me. One thing I should have mentioned previously is that we only serve patients who are aged 18 and older. The reason for that is because patients younger than 18 qualify for state-provided health care. Peach Care can be provided to anyone younger than 18. So if a patient is 18 or older, we can serve that patient. If we look at the age of our patients and which age group is typically the greatest of number of patients served at our clinic, those aged 50 through 59 are the largest portion of our patient base. As far as the city goes, if you look at the green section, 38% of our patients are living in the zip code of McDonough. 35% of our patients are living in the zip code of Stockbridge, and then so on and so forth. So Stockbridge and McDonough seem to be the areas where the most people in need are living. I believe that that's probably because the most development is in those cities at this point in Henry County, and so they're living close to where places to work and places to shop are. And then let's move over to gender. And 33% of our patient base are male and 67% are female. And then as far as race goes, we have a very diverse population of patients. 45% of our patients are Caucasian, 43% are Black, African American, and then the rest are Asian, Indian, mixed race, Hispanic. We have a lot of diverse groups in our patient and we're in our clinic, and we are very happy to serve anyone who walks through our doors in need. Next slide, please. Value of services. So this is pretty amazing. Our budget for 2021 is right at $540,000. It grew just a little bit from last year. Cost of services that we provide has increased because we have to buy supplies. So we are spending more buying supplies and paying for the expansion of services as well. So we grew almost $10,000 in 2021. So we're at $540,000 this year for our total budget. That includes all of our payroll, all of the supplies we have to buy, all of the educational courses that we teach. And if you look at the cost of the services we have provided, in 2020, our dental visits were worth $40,000 roughly. That's going to be significantly greater in 2021. Obviously, with COVID in 2020, we had to completely shut down our dental clinic for a number of months because of the CDC recommendations and then also provider preferences. Most of our dental providers are volunteers, and to ask them to come into our clinic during the time of the pandemic on a volunteer basis, most just didn't prefer to come during that time. They were working in private practices that were closed, and so they didn't quite want to come in as a volunteer in our clinic either. Volunteer service hours worth $80,273. That includes our physicians, our admin volunteers, people who volunteer at our fundraising events, worth $80,000 their time is. Medical office visits were worth over $253,000. Look at the total for medications. Is that not remarkable? $853,000. On average so far in 2021, the medications that we have provided to our patients total around $45,000 a month. So 12 months in the year, that's a lot of money. Piedmont Henry Hospital, that slide is a little bit, on this screen, is a little bit cut off, but the services that they have provided to us, they are a great partner of ours. As I mentioned before, they allow us to be in their building on their campus. In addition to giving us the benefit of being within their campus, they provide all of the diagnostics that we need for our patients totally cost-free. So if we need a patient to have an MRI or a CT scan or blood work done or a stress test, Piedmont Henry Hospital is so generous and helps us provide those tests at no cost to our patients. So their total was over $1,500,000 in services provided for our patients. Next slide, please. So how can you help? That's the big question. We really need to increase awareness about our clinic. As I mentioned previously, we've been in existence for 17 years. I will just tell you that before I became the director of the clinic, I'm ashamed to say I did not know that it existed. I personally have not ever had a need. I've been able to have an employer who provided my health care, or I had family members as I was growing up who were able to provide that for me. And I recognize that not everyone has that opportunity. And, you know, learning about the clinic for me was very humbling. I got tears in my eyes right now thinking about that. Sorry. Learning about the available services was very humbling for me. I'm so sorry. So it's so wonderful to know that, you know, our county and the people in our community care enough to support our clinic. In supporting our clinic, we're improving the entire community. And so we really need for more people to know about us. We need greater community health. We need for the approximately 18,000 people in Henry County as of 2020 who did not have health insurance to know that there is hope. There is hope for them to receive the care that they need and that they deserve. The care that we provide is not subpar care. We have top doctors and top facilities treating these patients with the best of care. When they walk into our office, it looks just like any other doctor's office. We have wonderful equipment. In some cases, we have better equipment in our facility than what my own doctors have when I go to their office, because we've had such generous donors, physicians and dentists, other people who have donated top of the line equipment to us. And we're just so blessed to have that. But we do need to spread awareness about our clinic so that more people can be served. Right now, we could probably take on another 1,500 individuals in the footprint of Henry County. We work very hard, tirelessly. If you can imagine everything that 7 people have to do to serve all the people that we're serving in so many different ways, we can still take on more people. We can do it. So if we could increase awareness, and then of course, always people can donate, organizations can donate. If you know someone that owns a large company that's looking for a way to be benevolent in this community, they can make a contribution to our clinic, and you can mail a check, you can donate through PayPal online using a link on our website on the homepage, or you can volunteer your time. We have so many patients who really just would benefit so well from knowing that there are people in the community that care about them. And if it's not pastoral care, even just to have a friend to talk to, if somebody wanted to volunteer and come into our clinic and just be a greeter, you know, and make the patients know that, or help them feel that there is no shame in receiving charitable care. Charitable care is here because it is needed, and it is necessary in order for our entire community to be as healthy as possible. So I'm just blessed to be where I am with this clinic, and of all the positions I have had here, this is my absolute favorite position of all. And it's just been a blessing to be a part of this great mission. So with that, I will answer any questions anyone may have, and I'll promise to do my best to keep the tears out of it.
Thank you so much, Ms. Amanda Reeves. That was so heartfelt. Just appreciate your initiative and just putting all the information out there, putting your heart out there. And at this time, we have the floor to have a conversation with Ms. Amanda Reeves. Any questions on the floor?
Thank you, Miss Amanda. I'm Ashley Frederick. Thank you so much for doing this for us and coming on and talk about the Hands of Hope Clinic. I'm gonna get right into it, to the questions. You kind of hit on this already, but I wanted to get more clarification about it. So are undocumented eligible for healthcare services at the clinic? I know you said that people have to present some type of documentation that they're residents of Henry County, but what about undocumented persons?
That is a very good question, and that's something that we are asked very often. And what I will say as the executive director of this clinic is we will not turn someone away who is sick. What I will say is a challenge arises when we have a person come in who may be undocumented and they have a chronic illness that requires expensive medication insulin, other medications for hypertension. We cannot get the pharmaceutical companies to give those medications for free to an undocumented person. And that's very unfortunate. Typically, undocumented citizens will go to the ER. The ER will not turn them away, and they will give them 1 or 2 weeks worth of the medication they need and say, see your primary care provider for follow-up. But when they come into our clinic, we're just a Band-Aid too, because we can't get them on a long-term medication because we can't get the pharmaceutical companies to provide those medicines. But we will absolutely see someone who comes in who has strep throat, or maybe they've cut their finger and they need some stitches, or anything like that. We're not going to say we can't help you here. But I will tell you, very few and far between that an undocumented person comes into our clinic. And the time that I've been with the clinic, I think we may have had 2 in the last 2 years.
Okay. Thank you.
You're welcome. And I think they don't come because
Yes, my name is Janelle Gadd, and I have a question along the same lines.
Sure.
I know you said undocumented persons may not be able to get assistance from the pharmaceutical, but what about refugees, people who are legally in the country but are not citizens?
Yes, absolutely. We would help them 100%. We would never.
Okay.
And if they're legally in the country, absolutely, we can get those pharmaceutical companies to provide that medication. If they have documentation that they are a legal resident, they absolutely will be assisted.
Okay, thank you.
Welcome.
Okay, for my next question, do you provide transportation for patients?
So that's a great question. And we do have a great number of patients who need transportation assistance. And there are a lot of programs through churches and through Connecting Henry, which is another, organization, nonprofit organization, who will provide vouchers for Lyft or Uber, and that helps a lot. And then we also have some churches who partner to allow us to give them a call and say, hey, could you provide a ride for this individual? And some of their congregation members are willing. So we do not have a specific ability to say, okay, we're going to come pick you up. That's not something that we are able to do, but we do have resources, and we're able to refer them to those resources to get that transportation assistance.
Awesome. Thank you.
My next question regards language. Do you have staff that are bilingual, specifically maybe French or Spanish? Because many of the people that we service with the RAP committee are people that speak French or Spanish.
Yes, we do. I'm so blessed to say that we do have a member of staff who was born in Guatemala and speaks Spanish very fluently. She is our mission support specialist. So her job title, it needs to just say, I do a little bit of everything, because she is a wonderful in so many ways. She helps with the grant writing, the grant reporting. She does almost all of it. And then with translating, yes, she can translate for anyone. And even if it's a day that she's not working, because she is a part-time worker, we call her and put the person on speaker, and she translates for us, and we're able to get the people assisted.
Okay, thank you.
You're welcome.
And our last question, Miss Amanda, I think you hit on this as well, but just wanted to get more clarification again. So if a person does need specialized services, I believe you do make referrals, but if a referral is made, are there any financial assistance available to patients?
So if we make a referral, it's to a partner who has agreed to see our patients for free. So when our patients are seeing a urologist or, a gynecologist or a podiatrist or a cardiologist, those providers have partnered with us, and they are seeing those patients 100% free. Now, that sounds fantastic, but I think in order to demonstrate how fantastic it is, we have had patients who have received free hip replacements, free knee replacements, surgery to correct glaucoma, so many different things. There's not enough time on this particular recording to be able to share all of the amazing ways that the partners that we have helped our patients. It is just incredible to see these very skilled physicians who have already worked a full day in their private practices come to our clinic for a night clinic several days a week throughout the month to see our patients in need. And the greatest thing about many of our providers is they encourage their children to volunteer at our clinic. And so many of them have college age or high school age children. And those children come, and I'm telling you, they are some of the most outstanding young people in this county. And we are so grateful that that is the type of work ethic and understanding and compassion that these physicians are imparting to their children. It's really incredible.
Awesome. Thank you so much for your time. I definitely appreciate it. And thank you for your service as well. Thank you.
You are so welcome. It's such a blessing.
I have one last question I wanted to ask. Our chapter services the citizens of Henry and Clayton County. And I was wondering, do you know of any organization or similar clinic in the Clayton County area?
Yes, ma'am. I'm so glad you asked that question. There is an entire network of charitable clinics in the state of Georgia. And for anybody who's looking for care for themselves or for a friend or family member, I would just recommend that you Google the Georgia Charitable Care Network. If you look on the Georgia Charitable Care Network's website, there is a search feature. You can search by zip code or by city, and it will list every single clinic that is a member of the Georgia Charitable Care Network. We are not affiliated in any way. We are associated. We join that particular organization and pay a membership fee to be a part of that organization. The Georgia Charitable Care Network does so much for charitable clinics. They have lobbyists who are working at the Capitol to get the funding that we need as a charitable clinic to be able to serve more people and to provide the services that are so desperately needed. So I would just say, have them go to the Georgia Charitable Care Network website. There absolutely is a clinic in Clayton County. There's probably more clinics around here than you'd ever imagine. I believe there are about 100 members on that network. And so all of those clinics provide varying services. We're all very different based on what we can afford to do and how many providers we have. But there is charitable and free care all over the state of Georgia. And you can find those through the Georgia Charitable Care Network.
Thank you. That's great information. And thank you so much for taking your time to come talk to us this afternoon.
It is all my pleasure, ladies. I'm so grateful for your sorority and your sisterhood. You all have supported our clinic for so many years, and in small ways and in big ways. We are just so filled with joy every time we see that pink and green coming towards our doors. COVID has changed that so much for us. You weren't able to really visit in 2020, but even though you couldn't come in, you still wrote and emailed and sent donations of, personal care items and money. And we are just so very grateful. You are an outstanding group of women, and I am just very, very blessed to have an opportunity to speak before you tonight.
Thank you.
You're welcome.
And I have a quick question, Tara Henderson. I have a quick question in regards to our safety and security because of COVID. You mentioned it before, but for our community members out there, can you give us just more enlightenment of how Hands of Hope has had to pivot as far as testing, getting the staff or the volunteers tested? Do they have to come in with a test, or would Hands of Hope provide them with the test if they were interested in volunteering or something of that nature?
So testing is very expensive. For a nonprofit clinic to be able to afford those test kits was cost prohibitive for us. So we would refer them because they could other places and get those tests rapidly or otherwise. And then we would allow them once they had a negative test. Knock on wood, throughout the entire pandemic, none of our staff members became ill. We were just very fortunate so far to not have any illness among our staff. We do appropriately socially distance. There's always a good bit of distance between each staff member and each office. We wear masks. We had very strict protocol with regard to how we would allow people to enter the building. They would stay in their cars, call us. We would do the temperature, ask all the questions, make them wear a mask. So we did really have to think, how are we going to do this? Because we're such a small group and we didn't have the electronic equipment we needed to really be telehealth immediately. So it was interesting, but we made it. And, while we did have a period of time where we were only doing telehealth visits, we are back open at full capacity now. And we were at one point leaving our doors locked and then having the people call, but now people can just walk in. We have signs outside that say to wear a mask, cover your mouth and nose. And we have just been really fortunate to have things go really, really well.
Great. That was a great response. And in addition to that, if the need is there, do you still do the telecommunicating visits if just in case, or are you?
The wonderful thing is that was something we had already begun talking about implementing, and I was working to budget that for our next fiscal year in 2022. That would be fairly expensive. One of the machines that we would use to do telehealth visits that can do all of the diagnostics for the patients remotely is about $9,000. And so when you have to spend $9,000 on one machine that is used for one patient at a time, that can also be cost prohibitive. But I was looking for a way to find corporate sponsors and grants and donors that would help support that initiative. And fortunately, we were able, with a lot of, the great thing about a charitable clinic and volunteer providers is that we have so many people that have connections and information and resources. So we were able to just spend a lot of time doing a lot of investigating to find out what's the best way to do this with, being compliant with HIPAA regulations. And we were able to find some really creative ways to continue seeing those patients. But now that's something we're going to continue forever, because especially in a community of people who are living in poverty, they may not have the ability to get out of their home and come and see us, but they still need the care. So the pandemic was a blessing in some ways for the clinic, because it helped us to really progress a lot quicker than we likely would have as a nonprofit organization.
Thank you. And my last question, in regards to the caregivers. So we are looking at the care for the caregivers, making sure our caregivers are taken care of. Do you all provide classes that will support the caregivers that are supporting those, maybe some of your clients that, are there classes that would be offered to them at whatever cost or no cost so that they can come in and get those types of services to support them?
That's a very good question. And that's something that I'd also like to see implemented at Hands of Hope Clinic. Being a caretaker for someone who has a chronic disease or illness, or a terminal disease or illness, is very difficult. And I'm speaking from experience with regard to that. It can really change your life for a long period of time and be exhausting. We have not implemented classes to teach people how to best do that. However, I will say that any of our patient family members, if we have a patient who is terminally ill, and we have had a number of patients who we discovered their cancer and they were very sick because they had avoided treatment because they didn't have access. Our staff is like a small family, and those are the types of relationships that we develop with our patients and with their family members. We are always available for questions, for text messages. We're on Facebook, so people can message us through the page all hours of the night. So we're available. And I think that's what we've been doing well so far. But I think you bringing up the point that training for how to take care of a chronically ill or terminally ill person is a very important aspect of healthcare. And it is something that we should definitely focus on as we move forward.
Thank you very, very much. I'm pretty sure the caregivers in the community enjoy hearing that.
For sure.
All right. Are there any other questions?
So what I said was we're always looking for ways to expand the services that we provide. And we love to poll the general public to say, what is it that you feel you need that would benefit our community? And then we can talk through all of those great suggestions and then implement them as we move forward. So thank you for that wonderful point of interest.
Thank you very much. Are there any other questions? Ms. Latasha, did you have a question?
No, everything has been answered or asked. So it's been very detailed, very informative. I've enjoyed your presentation, Ms. Amanda Reeves, and I'm just being a resident in Henry County. It's good to know that these services are provided for the citizens here in Henry County. So thank you.
You're very welcome. And let me just add that if anyone would like to speak to me directly, if they need to contact me to ask me a question or, for any reason whatsoever, please feel free to call me directly. You can call my office phone, and I'm just going to give you that phone number. It's 770-389-6818. I will always call you back before close of business. And if you need me more emergently, then call my cell phone at 678-787-3387. And then also, if you want to email me, you can email me at exec DIR, and that is short for Executive Director, at handsofhopeclinic.org. I would love to talk with anyone who has any questions or has any information they'd like to share with me.
Well, at this time, thank you so much, Ms. Amanda Reeves, for the information about resources in Henry County. And Henry County is blessed to have this resource in the community. And thank you for the information of the beyond. We definitely need that in our other areas that we support in our community. And on behalf of our president, Ms. Shana Rooks Malone, the RAP committee, as well as the Care for Caregivers, we thank you for this presentation, this information, and I do thank the RAP committee for coming on and communing with us and partnering with us. So thank you very much. And thank you, Ms. Latasha Robinson, for introducing Ms. Reeves. And Henry County, go for it. Grab this information and these resources. So step out there, and again, no worries, we have your back. Thank you very much, ladies, for joining us this evening. And thank you, community, and enjoy the information.
Thank you.